Hey, how's it going? Welcome to Tex Talks. Today's topic has to do with one-trick ponies versus jack of all trades, and maybe a few things that lie in between. What do you mean? All right. I had a conversation with somebody outside of the therapy setting where they were actually saying, I've been seeing my therapist and we've been doing this therapy and I don't seem to be getting, where I thought I would be. And I, like, well, it's not me to butt into another therapist's stuff. I said, but as a friend, I'll listen to you if you just have a question and maybe you can take stuff and, go back and ask it, research your own, I said, see where you're going from there, because it's not me to say whether another therapist is the right therapy for you or what's going on with that you need to do. I got the fuzzies in my screen. Let me see what I can do to fix that. Am I less fuzzy? There we go. Maybe I'll move a little closer screen to get clearer. Oh, well, hope the editor cuts that out. If you don't, hey, that's what happens when you do it live. You do it one shot and you let it roll. One-trick ponies are therapists who have one basic style of therapy that they mainly use. They don't use a lot of other types of therapy, and that is their thing they're trained in. Now, that could be CBT, and there's a few other ones out that they may be DBT trained, or maybe they have a favorite therapy that they stick to no matter what. They're good at that. They do that. Here's the thing. If you go to therapy, that therapist will probably have already explained to you, this is what I do. I do DBT. I do CBT. I do whatever style of therapy they have. To include, some people do mostly talk therapy. Now, I don't want to make it complicated and muddy the water. What will happen is sometimes people will say, I do CBT, and they kind of do a variation of CBT, or they do a little bit of CBT in talk therapy. It's mostly talk, and they take some of the skills and techniques from CBT and use them, but they don't go by the CBT model strictly. And this could be also for other styles of therapy. The thing that you will find is, though, that there are occasional times when you as a client have a certain mindset or a certain thought pattern or certain, difficulties you're dealing with, depending on your symptoms and maybe even your diagnosis, that style of therapy just doesn't seem to be working for you. Now, notice that that's different than sometimes you may get along with the therapist and whatever they do kind of works because you really get along with that therapist. Well, also, it's possible that sometimes you get along with the therapist, but the style they're using is not getting you the progress you want in your therapy. It's very important that two things occur. One, that we really do what the therapist is asking us to do for homework. We really put an effort into doing those things that they assign us to go home. If we have, challenges to do, we have, techniques we're supposed to practice. If we're supposed to put ourselves in a situation where we apply the techniques that we learned in therapy, and then we write about that and bring it back, I strongly encourage you to do that, because if you don't do those parts, then what may happen is the therapy may work for you. It's just that you're not actually doing the therapy. You're not doing the homework that goes with that style of therapy. You're not applying the techniques. Then that's, again, a possibility. If that is the case, that you are actually applying them, you're doing it, you're going home, you're keeping the journals or doing whatever that homework thing is for you, and you're still not making the progress you want, it is highly possible that that form of therapy just may not be what it takes. And that's a conversation for you to have with your therapist. That way, if the therapist has a different style or technique they could use, that's the impetus they need to say, well, then maybe we need to bump it to something different or go through something else. Sometimes people will come to me for therapy and I will start with CBT as a way to get a handle on what they really need to do to further their therapy. And that way they're getting some techniques, some breathing techniques, and some understanding of basic, depression or anxiety as we're getting ready to go do the next therapy. That way I'm building rapport, I'm understanding your problem. At the same time, I'm giving you some techniques to use. The techniques that you learn may really help you in a few areas, even though they're not the overall fix that you want. Sometimes you will go to a therapist and they will be more eclectic. They will be a jack of all trades. They take hodgepodges and pieces from several different types of therapy and they sort of combine them into what works for them as they do therapy with you. And again, you may find that that style may or may not work for you, depending on what you need and what you're trying to do. Because some types of problems are of a nature that you may need more specific therapy. In other words, you may have an eating disorder situation where you have certain behaviors that are related to disordered eating, and you need a certain understanding or a certain technique or a certain thing to work with in order to help you overcome those problems. And then the hodgepodge of different stuff isn't working for you because of your specifics. Or sometimes, maybe in the case of someone who has obsessive compulsive disorder, they may need a more specialized therapy. And I understand this gets even more complicated because nowadays so many people are telling me that they're so desperate to get any kind of therapy because everything has gotten backed up so bad that they're taking what they can get. If you do that, I get it. I understand. Please also accept, though, that the person that you're working with, hopefully they've already had a conversation with you that this is my style, this is what I can do for you. And at some point, we need to talk about shifting you to a specialist in eating disorders or a specialist in OCD or even a specialist in personality disorders or one who specifically works with whatever personality disorder you may be diagnosed with or whatever specific symptoms you're dealing with. And this goes in the same with if you're working with dual diagnosis where you have a substance or alcohol use problem going in with the mental health problem. Some people are not trained specifically to work with that. So sometimes you will look for people who do that specialty. What has happened in the past is I have seen many people who will go with, all right, if you're the only therapist that'll take me now, I'll take you. And then they find it difficult to make the shift later on when there's an opening for them in the other place. They don't want to leave the person they built rapport with. And I say take that into account when you're working with somebody, that the point is to learn and grow from them, get as much as you can, but then move on to do this other therapy. Then after that problem is dealt with, you always have the option of coming back to them or working with them if they're available. And that's a conversation you have with your therapist and go, I'm moving on to work with my problems with OCD. And once I'm done with that, I still have other things I want to work with. Can I come back to you? Having those conversations. There's a little caveat in there for therapists too. And this is what I've also seen. Some therapists get very stuck on their style, and it's very difficult for them to work outside of that. It is not a failing in their ability to deliver, say, CBT. It's that sometimes CBT simply will not work for some problems. This is where a therapist, and if there's any therapists watching, you realize too that you have to be able to tell your clients, we work great together. For your general problems, I can work with you. This, though, my style, what I use, just does not seem to be working. And be able to accept that and not take it personally and help the client transition into a therapist who can help them with the kinds of styles, techniques, or things that may be different from what you use. Why is this important? Sometimes CBT techniques can be very great for some problems. Sometimes, though, the difficulty may lie in something that lies outside of that, and the CBT can help with, people who feel stigmatized and they feel a certain way about what's going on. It can help with those things. It may not be able to help with the emotional mood swings of certain disorders. And realizing that and going, okay, that's something beyond the scope of my practice. Let's shift you into something else. Or in the case of trauma, it's a great prep for trauma work. But CBT, if you look and you look at the evidence, it may not be the best therapy for the trauma. There is CPT, which is the cognitive processing, and then there's DBT, and then there's actual trauma therapies like EMDR and other types of trauma, the trauma focused CBT. There are ways and paths to go. It's just that this one thing you're using may not be the one size fits all perfect fit for some people. Putting all that together means it's a constant case of evaluating the progress you've made, deciding, what your goals are. Are you meeting them? Where are you going with this? And when is a good time to move on to something different? Take all that into account. I hope that answers the question of the person who was talking to me too. And what should I do? Not to pull that old therapist thing on you, but what do you think you should do? I have to throw it back at you. I have to say, hopefully you've gotten to a place where you can ask yourself those deeper questions and go, is this where I want to be? And is this a good connection? And is this working? Because no matter how much you like your therapist, if you're not making the progress you want, and you and your therapist have went deep into evaluating what is going on, what's blocking the progress. Sometimes it may be the actual style of therapy, and you have to think about that. It may be that therapist's favorite style. They may be totally connected to this style, this acceptance and commitment, or, DBT or whatever. And it's really made a lot of progress with a lot of people that they've worked with. It just may not be your shoe and it don't fit. Try another one. Okay. And above all, talk to your therapist. Let them know what's going on. At some point, it comes down to, this deep conversation between the two of y'all to figure out where you want to go with things. Okay. So I hope you have a good day, and I'll talk to you later. Thanks very much for tuning in, and namaste.